what's critical is to look at, okay, what is it that we want to achieve at the end of the day? So it's not really building models for the purpose of building models, but being objective oriented. That's what is going to be critical. And that I've seen allows for then a structured process of looking at which point do you want to come in with a particular approach. And that way also brings the efficiencies in your own pipeline. You find units within ministries of health or within the health sector in general, entities that are they have different needs, and important to really kind of really scope out and see, okay, if we want to achieve an overall gain with regards to maybe how we are running the sector and improving efficiencies, then you can actually identify the spots you would want to enter. One of the things that is really critical at this point, I mentioned at some point that there's a shift in the health financing landscape. And so one of the areas that has really been discussed at length is really about enhancing domestic financing for health, governments investing more in health. But at the same time, a critical area has been around prioritization. There are certain approaches that one can think of in terms of how best do you optimize the health outcomes of a nation? And if we've got a limited envelope, and how do you split that envelope such that you're going to invest in the right interventions to get the best outcomes of interest? And now, while some of those aspects can actually be addressed, as Tariq indicated, with non-AI approaches, you could do them with mathematical modeling and identify ways in which you could come to that answer. But then within the pipelines of that modeling and so forth, you can also work on optimization techniques that build on AI. So I think it's a question of really looking at techniques that really are focused on saying, what is it that we want to solve? And I would presume that most countries at this present moment are actually thinking of ways in which they could better prioritize, ways in which they could really have allocative efficiencies given the challenges that are now pressing. And there are opportunities for health financing experts, the health economists, to work together with mathematical modelers, the AI experts, to come up with the solutions that are really appropriate for low and middle income countries that can be applied as soon as possible.